Untreated depression is dangerous. In the worst case scenario, people may self-harm or indeed take their own lives. So it's really important that people seek treatment at the earliest opportunity to give themselves the best chance of recovering more quickly. Going to see your GP is often the first and most important step. Now, whilst I accept absolutely that for some accessing help is difficult, not only because making that first step is hard, but because they may not know what services or response they might get. So in the first instance, there is much to be said for self-help. There's lots about self-help online, but equally it's about having a good diet, exercise, finding a way of sleeping, connecting with the outside world. All of these things individuals can do. But of course, if you're too poorly, it's often quite difficult to think of self-help and self-care. So that's when talking therapies can be incredibly important. And certainly GPs can prescribe medication. For some people, it takes a while to work out the treatment that will be the best for them. And sometimes in the worst scenarios or cases, a mixture of talking therapies or medication is the right way to go. Making that first step is the most important one. Once you get through the door and start that first conversation about how you're feeling, things can start to change. People may experience depression and recurrent depression that happens again at different stages of their lives. But with the right treatment, they can perhaps postpone those episodes and minimise the impact on their lives. Talking to line managers at work can often be the best way of staying in work and staying productive. And that's why workplace mental health is so important, and that we and other campaigners in the UK are trying to make sure that having conversations in workplaces, in families, in schools is happening, so that we can make sure, you can make sure that it's easier for that person to take the first step. Recovery is possible, and I think it's important that people hold on to hope, even when it's really difficult. Treatment can be effective really quickly, but for some people it can take time. There's probably no magic wand, but it is possible.